Welcome to the deep dive. Today we're tackling something really practical. It's about sharpening focus and tracking progress in healthcare.
Right. We're talking about using Gantt charts for quality improvement projects.
Exactly. Think of it like a visual tool, a superpower maybe, for making improvements stick and, ultimately delivering better patient care.
Absolutely. And if you're interested in making healthcare more efficient, more effective, this should be really relevant.
So in this deep dive, what are we covering?
We're going to unpack what Gantt charts actually are, explore why they're so valuable, especially in healthcare QI, which can be tricky.
Okay.
Then we'll walk through, how to create one step by step and look at the real impact they have.
And we've looked at some solid sources for this.
Yeah, we have. Insights from key players in healthcare quality organizations like Joint Commission International, JCI. They set global hospital standards. Also, the National Accreditation Board for Hospitals and Healthcare Providers, NABH, and ISQON, the International Society for Quality in Healthcare. Plus, practical know-how on using these charts.
Great. So a good mix of theory and practice. Let's jump in then. For anyone maybe not familiar, what exactly is a Gantt chart? Simple terms.
Okay, simple terms. Imagine a timeline for your project. A Gantt chart basically takes that timeline and breaks it down visually.
How so?
It uses horizontal bars to show each task in your project. The length of the bar tells you how long that task should take.
Ah, okay.
And what's really useful is it shows you everything laid out, which tasks happen at the same time, which ones depend on others finishing first, and the deadlines.
So like a roadmap, a visual roadmap for the project.
Exactly that. A clear visual roadmap for your QI work. And, it's not a new gimmick or anything. Project managers have used this basic idea for, over 100 years.
Wow, okay. Because it works, presumably.
Because it works. It provides clarity.
So it sounds simple enough, but why is it so crucial specifically in healthcare? Hospitals, clinics, they're busy, complex places already.
Well, that complexity, that busyness, and often, limited resources, that's exactly why Gantt charts are so helpful for QI in healthcare.
How do they cut through that?
Think about a typical QI project. You've got nurses, doctors, maybe administrators, IT folks.
Lots of different people involved.
Right. Different teams, different schedules.
Precisely. A Gantt chart brings clarity. Everyone can see the plan, what needs doing, when it starts, when it's due. No confusion.
So it helps with coordination.
Massively. Better alignment across those teams. Everyone's rowing in the same direction, basically. And accountability gets a boost, too.
How so?
Because progress is visible. If something starts to lag behind schedule, it's right there on the chart for everyone to see. It makes it easier to address delays quickly.
That makes perfect sense. And you mentioned dependencies earlier. Seeing those connections visually must help avoid problems down the line. Absolutely. That's a huge part of risk management here.
Right.
You map out, say, that you can't start trainee staff on a new protocol until the protocol itself is actually finalized and approved.
Right. Obvious when you say it, but easy to overlook.
Very easy in a busy project. The chart makes those dependencies explicit. So if finalizing the protocol gets delayed, you immediately see the knock-on effect on the training schedule.
And you can adjust.
You can adjust. You can reallocate resources. You can mitigate the risk before it becomes a major crisis for the project timeline.
Okay, I'm sold on the why. Let's get practical. How do we actually build one? Say we want to start using this for our next QI project. Where do we begin?
Right. It's a step-by-step process. It starts really with understanding the big picture. Step 1, define your project scope.
Meaning?
What are you actually trying to achieve? What are the specific measurable goals? What are the main phases or chunks of work involved? Get that clear first.
Okay, scope defined. What's next?
Then you break it down. List out all the individual tasks and, if needed, even subtasks within those main phases. Get granular.
Like really detailed.
The more detail, the better.
Yeah.
Usually. It makes the next steps easier, estimating time and tracking progress accurately.
Okay, so we have this long list of tasks. Now what?
Now you estimate duration. How long will each specific task actually take? And this is where you really need input from the people doing the work.
Their experience is key.
Absolutely. They'll have the best sense of realistic timelines. So estimate duration for each task.
Got it. Tasks listed, durations estimated.
Next up, dependencies. We talked about this. Which tasks rely on others being finished first? You need to map those relationships. Task B needs task A completed. Task C needs both A and B.
Okay, charting the logical flow.
Exactly. That's crucial for building a timeline that actually works in the real world.
So we've done the planning work, scope, tasks, time, dependencies. Now we need the actual chart, right? The visual part.
Now you choose your tool. And there are quite a few options.
Like software?
Yeah, lots of software. You've got things people might already use, like Microsoft Excel or Google Sheets. You can definitely build Gantt charts in those.
Okay, accessible options.
Definitely. Then you have more specialized project management tools, things like Trello, Asana, Monday.com. Microsoft Project is a big one. ClickUp, Team Gantt, tons of them.
Do they offer more features?
Often, yeah. Built-in Gantt views, easier dependency linking, progress tracking, collaboration features. But honestly, even just a big whiteboard and some sticky notes or markers can work, especially for simpler projects, or if software access is an issue. The principle's the same.
Good point. So pick a tool that fits the project and the team.
Exactly. Comfort level and complexity are key. Don't overcomplicate it if you don't need to.
Okay, tool chosen. Then we just plug in the data.
Pretty much. You input your tasks, the start dates, the end dates or durations you estimated, and crucially, those dependencies you identified.
And the software draws the nice bar chart.
It generates the visual Gantt chart for you. But, and this is important, it's not set it and forget it.
Ah, right. It needs updating.
Constantly. The final step is monitoring and updating. You have to track actual progress against the plan. Mark tasks as complete. Adjust timelines if things slip or, hey, even finish early.
So it stays a living document reflecting reality.
Precisely. That's what makes it truly useful day to day.
Okay, let's talk more about that usefulness. How do these charts really make a difference in these QI projects? We've touched on bits, but let's consolidate.
Sure. So first, planning and scheduling. We covered that. It forces that structured thinking, identifies all the steps, creates the roadmap that's fundamental.
Right, the foundation.
Then tracking progress. That visual check-in is so powerful. You see what's done, what's ongoing, what's maybe stuck instantly.
Allows for quick course correction if needed.
Exactly. And identifying dependencies, as we discussed, is huge for avoiding those bottlenecks and keeping things moving in the right order.
Prevents those cascading delays you sometimes see.
It helps, definitely. It's also great for resource management.
How does it help there?
Well, you can often assign tasks to specific people or teams on the chart. You can see who might be overloaded, where you might need more help, how much time is being allocated to different phases.
Ah, okay. Better visibility into resource use.
Yep. And related to that is risk management. Seeing the whole timeline layout helps you spot potential risks, tasks that are critical, dependencies that look fragile, and plan for them.
Proactive rather than reactive.
That's the goal. And finally, communication. This is a big one.
Keeping everyone informed.
Yes, it's such a clear way to show the plan and the progress to the whole team, to managers, to other stakeholders. Everyone sees the same picture.
Cuts down on meetings, maybe? Or makes them more focused?
It certainly can. Instead of vague updates, you're looking at the chart together. Yeah. So summing up the benefits: better planning, better communication, more accountability, smarter resource use, and fewer delays.
That's a pretty compelling list for any project, especially in healthcare.
Agreed. It brings structure and discipline.
Can we walk through a concrete example? Maybe that hospital readmissions project you mentioned. How would a Gantt chart look for something like that?
Okay, yeah, good idea. So project goal, reduce 30-day hospital readmissions. Big task number one might be data collection and review.
Okay.
On the Gantt chart, that task gets a bar. Let's say start date May 1st, 2025. Planned end date May 15th, 2025.
2 weeks.
Right. And as the team works on it, maybe by May 8th, they update it 75% complete. That progress is visible on the chart.
Gotcha.
Then, the next major task, data analysis. This likely can't start until, say, most of the data is collected. So there's a dependency link from data collection to data analysis on the chart.
So analysis might start around May 14th or 15th.
Something like that, exactly. Then, based on the analysis, you'd have intervention design. Maybe that involves brainstorming solutions, developing new protocols. That gets its own bar, its own timeline.
Dependent on the analysis being done.
Correct. Then comes implementation. This might be a big phase, maybe broken into subtasks like staff training, update documentation, launch new discharge process. Each gets its own bar on the chart.
I can see how it maps out.
Then you'd have evaluation monitoring readmission rates after the changes, maybe for a few months, another taskbar. And finally, reporting, summarizing the results.
So the whole project lifecycle, start to finish, is laid out visually.
Exactly. Sequence, duration, dependencies, maybe even who's responsible for each part. It becomes that central hub for managing the whole effort.
That really clarifies it. It brings structure, visibility.
Momentum, too. Seeing progress visually can be really motivating for the team.
And this all ties back to the bigger picture of quality and safety.
Absolutely. making these improvement processes more efficient, more transparent, more likely to succeed, that directly helps achieve the safer, higher quality patient care that organizations like JCI and NABH are all about. It supports their mission.
Right. It's a tool to help meet those high
It
standards.
really is.
Okay, so as we wrap up this deep dive, what's the main thing you want our listeners to take away? A final thought.
I think the main thing is to consider, really consider, how simply visualizing a timeline could help with any challenge or project they're working on right now.
Not just formal QI projects.
Not at all. Any process improvement, any team goal, anything with multiple steps and a deadline. Just think. Could drawing this out, even roughly, bring more clarity or shared understanding?
So the provocation is try it.
Yeah. Explore the tools, even the simple ones like Excel or Google Sheets, or just sketch it out. Map one of your current projects. See if that visual structure makes a difference. You might be surprised.
That's a great practical takeaway. That visual clarity could be a game changer, whether you're aiming for accreditation or just trying to make things work better day to day.
Couldn't agree more.
Fantastic. Thanks so much for breaking down Gantt charts for us. Really insightful.
My pleasure. Always good to talk practical tools.
Until our next deep dive, then.